Thank you all for these really inspiring presentations and works. Now I will invite on the floor the participants of the first round table, which I have the pleasure to introduce and open. So the first round table is titled Psychedelics in Therapy, Clinical Challenges and Opportunities. So a very warm welcome. Yeah, unfortunately there is not a proper table for the location, so you can just sit where you prefer. And we, as the chairs, we stay here, Mauro.
Stand.
So, a very warm welcome to you all. We are honored to have such a distinguished panel of experts who will bring diverse perspectives on this topic from the field of psychology, psychiatry, and neuroscience. Due to our limited time, I will introduce briefly each guest in alphabetical order. Tommaso Barba is a PhD candidate at the Center for Psychedelic Research, Imperial College London, and a member of the Scientific Advisory Board of SIMEPSI, the Italian Society of Psychedelic Medicine. Dr. Matteo Buonarroti is a medical doctor, psychiatrist in training, and vice president of SIMEPSI. Tania is an anthropologist, psychotherapist, and counselor of the Luca Coscioni Association. Federico Seragnoli is a psychologist, PhD candidate at the Geneva University Hospitals, and a member of the Scientific Advisory Board of SIMEPSI. And Dr. Pierluigi Simonato is a psychiatrist at the Dual Diagnosis Clinic, Parco dei Tigli in Padova, and a researcher of the Addiction Science Lab at the University of Trento. And Sofia Venturini holds a research master in cognitive and clinical neurosciences, drug development and neurohealth from Maastricht University, and is also a member of the Addiction Science Lab at the University of Trento. So thank you all for your presence and contribution. I am pleased to chair this roundtable alongside Dr. Mauro D'Alonso, psychiatrist and president of SIMEPSI, the Italian Society of Psychedelic Medicine. So thank you, Mauro, for being here, for helping in coordinating this roundtable, and for the incredible work you're doing here in Italy with SIMEPSI.
Thank you, Gabriele. And before addressing the first question, I would love to thank Professor Ornella Corazza and all the organization for making this possible. The first Italian conference on psychedelics is, I think, is a really important point in time for the development of this type of field in Italy, which is starting now. So we need things like that. So thank you for letting this happen, for bringing people together from different fields. I think this is really important. Coming together, be united, try to understand each other, talk to each other, and be able to stay in the same room trying to harmonize the field, which needs to be stabilized. So, thank you very much. The first question is, in your opinion, what are the main reasons behind the growing interest in researching the psychedelic therapeutic potential of psychedelics? And how do psychedelics differ from other pharmacological treatments currently used in psychiatry? I don't know, Tommaso, you want to start first?
Hi everyone, I'm Tommaso and I work at the Center for Psychedelic Research. And yeah, in answering to what Mauro just asked, I think that behind the reasons, I think there's probably an element of looking and wanting for something new. I think current treatments in psychiatry has been pretty the same, especially in treatment of the depression and anxiety when the SSRIs were developed quite some years ago. Since then, there's been no major change or no major paradigm shift, and I think people are eager for having new solutions, new approaches compared to what is working right now, because not every patient is happy with these treatments, and they tend to work, as David briefly mentioned in his presentation, they tend to be good at reducing symptoms of depression like sadness, but they normally do not improve well-being very much. And for patients, it's not only important for not being sad anymore, but it's important to also like feeling that their life is worth living, to be connected with the people around, and overall to feel happy. And I think this then links to the second question. It is, how do these treatments work differently from current pharmacological approaches? And we try to understand this better in the study that we ran a few years ago, where we compared psilocybin-assisted therapy consisting of 2 doses of psilocybin combined with around 20 hours of therapeutic support with a 6-week course of the SSRI escitalopram combined by the same amount of psychological support. And what we found at the end of the trial was that patients, even if they had the overall comparable reductions in depressive symptoms from the main outcome of the study, that was the quick inventor of depressive symptomatology, we found that in other measures that were looking at well-being, anhedonia, work and social functioning, sexual functioning, connectedness, and so on, psilocybin was outperforming patients treated with classic antidepressants. And we found this at the 6 weeks main endpoint of the study, and then we also found it later on at the 6 months follow-up of the study. And despite this being quite a small sample, it was around 60 people, and 30 were treated with psilocybin, and another 30 were treated with escitalopram. Overall, it suggests that these treatments might have additional benefits that are not happening with existing treatments for depression. We found something similar in the neuroimaging studies that we run, as David showed in his presentation. They can have a different mechanism of action in the brain. We also found that SSRIs tend to have general blunting effects of emotions. We found that people were less sensitive to recognize emotional phases after being treated with SSRIs, but this did not happen with psilocybin. It is another index that these approaches might not induce the reduction of the emotional spectrum that people are normally able to feel, potentially leading to an increased quality of life.
Thank you very much, Tommaso.
Thank you.
I will pass the microphone to Sofia.
Thank you very much. Yeah, I mean, I completely agree with everything that has been said so far. And I think another very interesting aspect for which psychedelics are so under the spotlight at the moment is also not just the therapeutic aspect, but also the fact that they give us means to study human perception and human consciousness. But also, this is a more recent aspect, I would say. There has been an increasing media coverage, just going from articles on the New York Times, coverage on CNN, or even new documentaries that are available on common streaming platforms. So this definitely generates a lot of interest in the public, generates curiosity, and in a lot of cases, it also makes patients more willing to go and try these kind of treatments. So even there, more clinicians will want to specialize there. So I think this is all quite related, and in the end, it's a little bit of a vicious cycle where we see growing interest, growing media coverage, and in the end, even more interest. And relating to the second part of your question, again, I agree with what was being said, and I really think that also from what we've heard this morning, psychedelics have this particularity that they somehow manage to go to the root of the problem, and they allow patients to understand where the suffering comes from and how to confront it. While conventional treatments might mitigate symptoms a little bit more, psychedelics actually do allow to work on the problems. And what we've seen also from the previous presentations, I think, is that they really give means to patients to realize that their life goes beyond their illness. So it also allows them to confront painful or traumatic memories without focusing on all the negative emotions that they would normally associate with it. So, for example, loneliness, guilt, sadness. But as was also being said, they do allow patients to focus on the more positive emotions. And what I think is also very important is this ability that psychedelics have to allow participants to get out of their very rigid thinking schemes, which is very often seen in depression and even more in substance use disorders. And this, of course, then also relates to what happens within the brain, as we saw with Dr. Erizzo. Psychedelics allow communication within different parts of the brain that normally would not communicate, or not as much at least. So this really, I believe, it reflects this aspect of cognitive flexibility and really allowing patients to look after and realize there is more to come with this. And another very interesting aspect, I think, is just the frequency of dosing. So with classical treatments, patients are basically always under the influence, but with psychedelics is very few sessions. So also the fact that patients have the opportunity to confront what their true emotions are without them being numbed, as Tommaso was saying, by SSRIs, I think is also something quite essential and quite unique.
Thank you, Sofia. Matteo, do you want to?
Yeah, thank you. Hello, everyone. Well, as we have seen today, I think that the excitement surrounding psychedelics stems from the very properties that distinguish them from other treatments. And the distinction is not, I think, solely based on the pharmacodynamics or on the fast-acting efficacy. Rather, the appeal of psychedelics lies in the interplay between the pharmacological properties and the phenomenological aspects of psychedelic experience. Because this complex interaction creates an emergent property that fosters innovative and integrative clinical interventions, such as psychedelic-assisted psychotherapy. Moreover, beyond opening new possible clinical avenues, psychedelic experience leads to several implications across various fields, because it triggers cross-disciplinary research, debates, initiatives, that are vital for the advancement of science and culture, and these consequences are really less pronounced in reaction to other brand new medication or psychotherapeutic method. As a result, psychedelic experience leads to several implications across various fields. And this has given rise to a vibrant cross-disciplinary community that merges a scientific exploration with cultural inquiry. And also the interaction of these domains is vital for innovation. And I think this could trigger potentially a scientific and a cultural renaissance that psychiatry as a discipline dealing with the mind-body-culture relation desperately needs. Psychedelics challenges the traditional mind-body dichotomy because, unlike other medications that are often misinterpreted as direct therapeutic tools because they subtly influence subjective experience, generally without a breakthrough action, psychedelics instead induces profound shifts in consciousness that deeply affect the individual, and this experience, together with the induced plasticity within a psychotherapeutic context, all of this complex system seems to be related to the efficacy of psychedelic interventions. And well, it's well known that best treatments often combine psychotherapy with medication, and this synergy exists because both approaches share a common mechanism, that is, supporting the individual, fostering a comprehensive therapeutic change, a better adaptation to the environment or to internal needs. Under this perspective, psychopharmacology could be seen as a tool for psychotherapeutic method whenever it's used to support the psychotherapeutic work. But generally, in clinical practice or within research settings, psychopharmacology and psychotherapy are not connected in this sense. Psychedelic-assisted psychotherapy could represent a significant paradigm shift because it's grounded on this emergent property that arises from the combination of drug action, subjective experience, psychotherapeutic context, and these emergent layers, emergent therapies, requires sophisticated research methodologies in order to be fully understood. And this epistemic and methodological need involves also the challenges of assessing the efficacy and safety of psychedelic therapies, along with the complexities of the placebo effect that's partially related to the topic of blindness of psychedelic trials. And all of these complexities stress the research methodologies on which we rely that are necessary but limited. And I think this could help an entire epistemology to evolve and hopefully change.
Thank you, Tommaso, Sofia, and Matteo for your insights in this conversation. Now, just continuing the last issue that Matteo underlined, I'd like to dive deeper into an important implication of emerging therapies in psychedelic science. So, the clinical use of psychedelics is often seen as a combination of drug action and psychotherapy, as you were saying. So, in your experience, how significant is the role of psychotherapy in this context? And what do you see as the primary challenges in advancing this area of treatment? Tania, can you maybe start this, sharing your insights with us?
Okay, everybody. Hi to everybody. I think, as I told you this morning, that psychotherapy is a crucial part in the psychedelic therapies. I am also a medical anthropologist, so I had the opportunity to visit the Amazonian, where there is a shaman, and the shaman is like a medical doctor who knows precisely what is not just the plant or the mushroom, but the journey. And I think that we have to remind to ourselves which are the deep roots of the psychedelics therapies. Not because we have to go to the Amazon, because not for all the patients this is possible. But I had this experience some years ago. I organized this journey to the Amazonian, and a colleague, she was a psychotherapist. She called me at the end, just a few days before leaving. And she asked me, okay, I want to go with you. I want to go with you guys because I am a psychotherapist and I listen to these beautiful things related to psychedelics. And I say, okay, which are your, have you any preparation with meditation, with not ordinary state of consciousness? And she say, I did 10 years of psychotherapy. She came with me, I was with her, and during ayahuasca session, she started having a paranoia, very, very deep, and I can't remember every minute because we have to go out from the Maloca, the place, and I stayed with her with this bad trip for I think 6 hours without any kind of drugs or to repair the situation. And so we have to say that relating to psychedelics, there is also there are side effects and there is a dark side of the story. And we have to recognize that exploring consciousness, it must be a human right for everyone. But not all the journeys are good. Sometimes, as I am a psychotherapy here in Italy, there are some young people like you guys, the students that are here. And they ask me and they say, okay, I went to this place and I had this experience. And without any preparation and without integration, and so this part can be dangerous for the person and also for us as a movement. This is why I think that psychotherapy is an important part. and also the preparation for a psychotherapist. It is not enough to have a degree as a clinical psychology, because working in this field, we have to think also about a training for us as a clinician, just to ameliorate and to give the best possibility, the best therapeutical possibility for the patient and for all the people.
Thank you, Tania, for your considerations. So, Federico, you want to add something to this discussion?
Yes. Thank you.
So you took the mic.
Thank you, yes. I'm very grateful to be here, and I would like to thank the institutions that made this possible. I really think that it's very important to have some multidisciplinary dialogue around all of this. So I'll just try to answer with a couple of ideas about this issue on coupling psychotherapy to psychedelics in clinical settings. This comes from my experience as a psychotherapist in training in Geneva University Hospital, where we do since 4 years psychedelic therapy as a routinely option that we give to the population. And my experience means what I've read in books, what I've listened to in conferences, but also about what I've seen in my clinical practice. I would like to start with an analogy. So the idea would be to take this example of a child learning to ride a bicycle. So as you can picture it, if you remember yourself having done that, or if you just think about a child doing that, we have this tool that we try to manage, to get comfortable with. This means that the person tries to understand this tool with some declarative processes, like understanding the pieces of this tool, how it's called, etc. But then the person has really to try to go on the bike and try to make it. At the beginning you have these little wheels, and then they get them read from the bike, and then you can actually ride a bike. So the analogy here, I would like to just stress on 3 points, meaning that there is a difference between the declarative knowledge that we can have by reading books or understanding many things within the language and the reasoning aspects of our understanding of reality, but then there are procedural skills and knowledges that we can learn just not with language and words, but by doing things and expressing other kind of competencies. And also, keeping on the analogy, you see that a child is doing that in a particular age. It's a window of plasticity for that. This is also important because maybe psychedelics open up to such moments to enhance the learning opportunities, also procedural learning opportunities. And then you see that something happens on the way you learn it, also for a musical instrument, for example. At the beginning, it's very difficult. You have to put a lot of attention and effort, but then you integrate it, and then even if you didn't ride a bike since 10 years or your car, you're still able to actually get on it and start. While for some declarative knowledge, I think, know that you get to lose it. So all of this to bring then to the therapy, meaning that if we observe this from a very concrete perspective, what happens is that psychotherapy moment is a training process that happens a lot on the declarative side, right? So we do a lot of talking, we do some psychoeducation, we try to let the person know about the human mind, the psyche, the brain, the body, etc. But then there is a lot that is happening which is not going through words and language, but through processes. Just to give you 3 examples, emotional self-regulation. For example, imagine a patient coming and saying that he has anxiety, panic attacks, or whatever, and we are like, okay, we try to understand where it comes from. We get to see that there is a trauma at the time, in age, etc., in the development of the individual, and then we could be like doing some psychoeducation, you know. So I think this trauma created an effect on your stress regulation, etc. And then the patient is like, okay, and now what do I do? So basically, emotional self-regulation is a procedural aspect of the way that person can then work on herself to get better. Another one is like cognitive self-regulation. So the way the person tries to orient her attention in daily life to try to get the goal that she gave to herself. This is as well something that you cannot learn just by reading or by language. You have to train this capacity. And the third one is all the attachment issues and processes that are going through a therapy. These as well are things that you cannot just learn with language. All of this, to conclude, would be to say that basically psychotherapy is also an invention of the human creativity and of our expression to make things work, and it's a tool in itself, and it's evolving. And in this way, when we deal with people, we really have to think that even if now we got to the extent of knowledge that we know where human capacities and processes comes from, like the brain and the body, etc., the neuroscience of all of this, we still are facing a person. And when we deal with people, they don't like to be taken just as brain into bodies. They like to be taken as people, and they better reason with that. So my point would be that it's a very, very rational and logical thing to do psychotherapy with psychedelics, and it's not one or the other, it's just making the best out of all the options that we have and put them all together.
Thank you, Federico, for sharing your experience and thoughts with us. I'll pass the word to Pierluigi.
Thank you.
And then we have additional time for some more consideration you can have, so feel free to take the mic after Pierluigi.
Thank you very much. Thank you for the organization, first of all. I'm a clinician, so I'm a psychiatrist, and I'd like to emphasize two main points about psychotherapy and psychedelics. I write down two brief notes about that. The first point is that psychotherapy probably has the first value in identify the vulnerable patients, which means that in the first phase when we evaluate patients, we can identify the patients who are more susceptible to bad experience, which means that, for example, in our field, when we prescribe an antidepressant or an antipsychotic, we need to assess the level of psychopathology. And that's the first point. And the first point here that I want to emphasize that we need always to be good psychotherapists and clinical activists, because we need to identify the real patient who can use a treatment. And the second point is about the neuroplasticity. In my opinion, for what I can understand from this research about psychedelic, is that these drugs are able to increase the neuroplasticity, which means that the main point is that these drugs can increase the ability to change. And so the point is, why we prescribe an antidepressant? Because we want to ameliorate some symptoms, okay, for example, depressive symptoms. But sometimes is not enough. It's not enough because, for example, in the main important guidelines at the international level, always medication comes with psychotherapy, talk therapy. So The point here is that all our drugs, SSRIs, for example, are able to increase something that is not only the serotoninergic level of our patients, are able to increase neuroplasticity. And now we can understand that psychedelic drugs can maybe be able to increase more and more neuroplasticity. So the psychotherapy is essential because it's a guide to recover our patients, our future patients, in any kind of disease, depression, anxiety, or also addiction we learned today. And that's a novelty to me because in the addiction field, the use of psychedelic, it's very controversial. I think that it's a big novelty. Okay? Thank you.
It's up to you if someone wants to add something, otherwise maybe we can ask some questions from the public just in a free mode.
Thank you very much. Also relating to your second question on psychotherapy, with Professor Corazza, we actually ran a study where we were investigating the phenomenology of psilocybin experiences. We were interviewing people that had used psilocybin, and we were asking them to report on a meaningful experience. And what we have also seen quite consistently is that even participants, they felt the need for integration, because what they were saying is that from those experiences, they could get a lot of insightful messages, a lot of strategies, let's say, on how to confront their issues, but they were not necessarily able to prolong them on a longer term and integrate them into their daily lifestyles. And also relating to that, I think this kind of relates as well to what Dr. Simonato was saying, relating to the plasticity. That, as far as we're seeing now, for example, with psilocybin, plasticity also happens in regions that are associated with memories. So I think relating to that, it's again also this capacity of reprogramming the memories in a sort of way and allowing to focus on different emotions.
Yeah, maybe something very brief to add on this that I think it just like contributes to the complexity of this topic is that if you look at more as at a regulatory perspective, like what's the minimum amount of psychotherapy or therapeutic support to put together with these drugs in order to make them safe and deliverable to the population? Because if on one point having no therapeutic support might be, in some cases, dangerous. Also having a very strict therapeutic regimen to give mandatory with these drugs can also be maybe not the most cost-effective solution, and these therapies will be already expensive, might be difficult to implement in the broader population in the future, so you don't want to make it too strict, also to avoid a future widespread use, or maybe a cost that is too high and then becomes a sort of luxury of psychotherapy that I think is also like a possible outcome that possibly is not the optimal one. And different drugs also works in different way, like treatments with MDMA might require more active therapeutic involvement. Others like psilocybin or LSD, the acute drug support might be more just related to be present in the room in case something happens, but these drugs generate more of an inward journey, and then most of the support will be done before and after the session. But I think what's the right amount of psychotherapy or support to give is still a very open question, and possibly a very tricky one to decide on.
So thank you. If you from the public, Federico, yeah, go for it.
It was to add to the integration part, because also we've heard you said before. Basically, you can have just so why it would be that this work long term. Basically, the fact is that thanks to the psychedelic, we give this experience to people for them to feel and regulate themselves in a different way. So this means that if they integrate this new way of feeling about themselves or dealing with themselves, with their own consciousness in a different states, then they can just keep it. They learned it, and then they basically can keep it for their whole life. So that's why also it works on the long term. This part of the integration works because there's an actual learning process that happens during an altered state of consciousness on different levels.
Okay, thank you. So there are many challenges that we need are ahead and we have to face, and one is the regulation and the other one is the appropriate protocols and stuff and approach we have to be. So there's loads of things that we will work together, I mean. So I think it's time to go. So we need to pass to the other group.
Yeah, thank you, Mauro. Thank you to everyone. It's already 5 p.m., so we will have a moment for the Q&A just after the second round table. Unfortunately, I was just looking at the time, but thank you very much for your contributions.